Okay, we're going to lengthen some of the nerves in the pharyngeal arches in the front of the throat, supplied by the cranial nerves in the cervical plexus. Some extension of the head takes place here. So we've red flagged these people before that they're not a stroke risk. And we always monitor, we have them with eyes open. So when we're looking at them, we see if there's any nystagmus. We always talk to them, communicate to see if they're feeling dizzy or starting to slur their words. Now you see I'm traction in this direction, and these structures are going to start stretching. Will that stretch in there?
Mm-hmm.
I can add a little more traction. I can add a little more extension. Lots of structures in the pharyngeal arches. Lots of structures in there, organs in there, esophagus, parathyroid gland, the thyroid gland, blood vessels. Lots of this can be affected. Of course, we can do this all on the other side as well. We can add a little more extension to the neck, some of the deeper structures. More flexion in the neck, different structures again. Pressure on, pressure off. Pressure on, pressure off. Hyoid bone. I can push that hyoid bone down somewhat. Traction the muscles above it. Push the hyoid up with some neck extension. Stretch the muscles below it. Same thing with the thyroid cartilage. I can stabilize that and bring the neck back with some traction. They're pretty tender though. I'd be very careful with this because the thyroid gland is right there. These tissues are quite sensitive. If you poke around too much, you're going to get quite sore. Recurrent laryngeal nerves. Recurrent laryngeal nerve, as you know, the left recurrent laryngeal nerve goes around the aortic arch before it comes back, and the right's under the subclavian artery, if I'm not mistaken. If we can pull that larynx up as we stretch the head back, maybe we can affect the recurrent laryngeal nerve. Maybe that's going to make a difference in the joints in the retinoid joints, the muscles in the retinoids in the thyroid cartilage and the cricoid in our voice box, the vocal folds. Maybe it'll have an effect on that. Always monitoring the patient. Suboccipitals. In another tape I talked about the relation between the trigeminal nucleus of the fifth nerve has a spinal center. Traction in the suboccipital area, thus. That's going to have an effect on that fifth trigeminal nerve. The procedure I showed you that brought the head back, when I change the discs in the upper thoracic spine and bring the head back, that changes the mechanics of the jaw. The muscles of mastication are more relaxed, jaw changes. Muscles in the face. Muscles in the face. The facial nerve is motor to the muscles in the face. Theoretically, you can load those as well. You can load the nerves on those, like pulling the lip, for example, or the nose over. Something you can think about.